All right, it looks like we are live. Welcome, guys, to the All Things Male podcast. This is a live recording, so might be a mess, but we'll go with it. So today we are going to be talking about the role of healing in PE, PRP, the P shot. Let's see, peptides, particularly BPC 157 and TB 500. And at the end, we'll talk about goal setting strategies. Normally, we will take submissions from our Reddit, All Things Male Pod, but it's been like 3 months since the last one. We didn't really have any relevant submissions. So if you have any content for us that you want to make, or for us to make rather, post them there. But yeah, we can get started.
Let's do it.
So I think Adam is up. Or perfect.
Yeah. Okay. So I guess to start, we wanted to talk about the role of healing in PE. So do you want me to
Okay.
open with this, or what do you want?
I got it.
Okay.
Let's see. So healing has been a bit of a discussion between us three. Me and Perv believe we need rest to facilitate maximal and optimal games. Hank has been doing a relatively short routine every single day that he can, and he saw comparable games to us. So we are here to discuss what exactly we think is the deal with rest and if we need it.
Yeah. Who wants to start?
Am I allowed?
Yes.
You're allowed.
I'm only gonna go when I'm allowed. For everybody who's watching, for all the 8 people that are watching, I've got a word counter around my neck attached to a piece of C4 that's inside my thyroid gland. If I go over a certain amount of words,
you are using your words now, Adam.
I know. Okay. So,
I mean, Perv, geez, sorry.
For the people, you can call me whatever. It doesn't matter. Everybody knows.
All right.
Adam, whatever. So I think Hank and I kind of touched on this on the tail end of our podcast last week. So I'll just reiterate what I said there because I do believe that it is relevant. I think that training age is important when you talk about PE, when you talk about physical training, and then also conditioning. Conditioning is really important. So what does conditioning in PE mean? Well, we talk a lot about EQ. We talk a lot about like your cardiovascular health being a huge component of it, lymphatic system being a huge component of it. I think it's some people will argue nutrition is a component of it. And I think that you certainly don't need to be malnourished. I don't think that, being in a caloric surplus or anything like that is necessary for PE. But I think that total volume is something that people need to think about. So Hink says he does basically like a little bit every day, whereas you or I like to basically blow our dicks off for an hour and a half of
maybe 3 years ago, but yes.
So what I'm saying is like we need to start thinking about like a total training volume, and we need to start thinking about it in terms of ways that we would normally think about training volume if we were training our physiology. So one of the concepts that I think that we should sort of start to introduce in PE is what we call your maximum recoverable volume, and basically just have people understand that there is a total workload that you can perform that you can actually recover from, and above that, that's where you get overworked.
Right. So let me ask Hank something. How many minutes do you do a day for PE?
Oh, Jesus. Here lately, it's been like maybe like 5 minutes of manual stretches and then like 10 minutes of pumping, just with everything going on. But
so 15 minutes a day.
So on an average day, my routine has kind of shifted just a little bit in the sense that I've kind of split it up into like a twice a day routine, not by design, but by necessity. Mm-hmm. And so I will literally do like maybe 10 minutes of manual stretches and then like 10 minutes of pumping in the morning. And then honestly, something pretty similar at night after I freaking finish up with stuff at home and actually get time to do PE and, right before bed.
So we'll just say 30-ish minutes every day.
No more than 45 minutes on any given day.
No more than 45. That's more than I expected, to be honest. So
Yeah,
what
but that's like
I
20
do,
minutes of stretching and 20
20
minutes
minutes of
of
stretching,
pumping.
20 minutes of pumping.
Yeah.
Okay. So what I do is about, I would say 35 to 40 minutes every other day. But there's a little more dedicated
Okay.
work with the chemical release and everything like that. I think Adam's doing stuff similar to me, but he is more meticulous with this. He like tracks strain and fatigue every day, and then that's how he decides
Mhm.
his rest days. Are you still doing that, Adam?
I am. I'm still doing it, and that's actually part of like what I was texting you about earlier.
Okay.
Because so I can't. I just need to go ahead and make my video on how I auto regulate training, but I let my body decide when it's ready to train and when I need to take a rest day. And I do that by tracking my bone press stretchable acid length every day. And basically, I have metrics that are, pretty well defined within my training where like I know if I am at a certain BPSFL, like on a certain day, that I might as well go ahead and train that day because I'll hit 2% plus strain, or if I'm still fatigued, like if I'm still showing elongation from the previous session, like it's probably best that I just don't because I'm not going to hit my strain rate, and so it's like recovery is indicated by that measurement.
So what I do in that situation is I actually go off a little bit of erection quality and skin quality because that seems to be like the main issues for me is that my skin gets too beat up to actually do PE.
I think the other thing that to note though is that you're way more experienced in terms of like intuition with PE than I am.
Oh, I have a
You just
lot of. I'm more sensitive in general, I would say.
right, and so that's the thing is that whereas I tend to be that way with powerlifting because I've done that for over a decade.
Right.
I need a little bit more concrete numbers when it comes to PE because I'm just like I don't consider what I feel to be valuable data. I just don't.
I
I
get
know
it. I
some
think
people
Hank's the
like
same way.
yeah, I know some people like Ben from Mailhanger, like they talk about feeling fatigue and feeling, strain and stuff like that. And I don't doubt that that can be a helpful metric for a lot of people. It's
Mhm.
just not something that I consider myself reliable enough to like auto regulate myself, if that makes sense.
Yeah, that makes sense. Do you have anything to add, Hank?
I like sometimes I feel really stupid when it comes to PE because I understand like fancy science terms, but like even things like a basic principle of fatigue. If somebody were to ask me like, what does fatigue feel like? I'd be kind of be like, I don't know. I think it's like one of those kind of subjective things, and so like erection quality, I definitely think that that's a solid. I mean, that's pretty obvious, but like one of the reasons why I don't feel recovery is like or like rest days are as important for me is because especially like I supplement with not intentionally plugging like vigor here but like I do vigor like at least 2 scoops a day and restock is coming guys but I also have a kind of micro dose to occasionally macro dose like a PDE5 inhibitor like
Hmm.
Viagra and
Right.
that increased blood flow and there's a lot of clinical literature that can help when we're talking about like basically injury recovery and so uh
Can I
I
like interject for like two
yeah,
seconds? I just
please.
want to point out something because like what? Shut up, Edie. I'm gonna smack you. I
I'm
swear I'm
just
gonna cut
enjoying
you
the
off.
conversation.
So, Hank, what you're displaying is what I would call a high level of conditioning. Okay, so
Hmm.
you're like what I would. Don't take this the wrong way because I actually admire CrossFitters.
Oh,
You're
dude,
you're
if you
you're
call me
doing
a
what I would think
CrossFitter,
about
I'm
as
gonna fight. We're gonna fight if you call me a CrossFitter. Do not insult me
okay,
like that.
cross training athletes that train every day.
Someone in
Okay.
chat is
Um,
very upset.
so think about it like this, though. I mean, CrossFit athletes, they really do have really high levels of conditioning. They
Hmm.
actually have some of the highest levels of conditioning of any athletes that we've studied. There was a study actually that was done here in my home state, USC, where they found that CrossFitters, out of all the
Yeah.
groups that they tested, they could actually maintain like the highest, like they could redline the highest, the longest out of anybody that they looked at. And so they have a high level of conditioning. And so what that means is they have a high level of recovery. And so all the stuff that you're doing, like taking the PDE5 inhibitors, taking vigor and all that stuff, like that's directly contributing to you having a high level of like you're taking your maximum recoverable volume and you're bumping it up here, you know.
All right. So my argument against that is there's a clear amount of time collagenous tissue needs to heal, right? So like if it's 3 days, for example, if we're going to be chronically fatiguing it for more than 3 days, aren't we going to be actually setting ourselves back a bit?
I don't
Yeah.
think that the numbers are. I don't think that the numbers are actually.
Well, you're not going to fatigue the entire penis on one go, especially if
No,
you're only doing 25 minutes a day, right?
I don't think that the numbers that have to do with that are as concrete and as referenceable as we want them to be. Just because you have to again consider what we're talking about is like training age. So like if we're going to talk about ligamentous and collagenous tissue, you know, in trained athletes, that's totally different than like your average Joe. You know what I'm saying?
Right.
So again, conditioning comes into play there. And I mean, we know that their connective tissues will heal at a much faster rate than the average Joe. Even though they are actually able to put more strain and fatigue onto them, they
Mhm.
have a, you know, a super compensatory sort of mechanisms that can allow them to heal a little bit better.
You
So
wanted to add
that
something,
would be
Hank?
my,
Sorry, Adam.
Yeah. So
no.
mine is going to be like basically just like there's extremely limited evidence in any kind of like penile enlargement, like period. But if you do look at like the extender studies, or even like most recently the P long study, which we know is full of flaws, like none of them include rest days. And even on those trials, they're using like extenders for 4 to 6 hours per day. And so if you were to ask me, I mean, you guys know how I feel about like actual medical literature, then I would say, well, there's not a strong argument from the what limited literature we have that rest days are that important. Now, if you actually look in like the discussion of these papers, they're not talking about like, well, we looked at the collagenous tissue. They're just like, yeah, well, we pulled on our PPs and they grew.
Exactly.
So, hooray. So, I mean, I understand the limitation.
Yeah.
Um, and I guess it's just in its infancy, and I personally, admittedly, I have not done a deep enough dive into like collagen, and that's one of like my upcoming videos. And I honestly might completely change my tune. I reserve that right. And just for the record, when I am coaching, my clients or whatever, I tell them that if it's a short routine like mine, then I say, yeah, you can absolutely do that. I think 6 to 7 days a week. But once again, I still take at least usually 2 rest days a month. It's just they're normally forced upon me. So
Okay, that's what I figured. So back to this extender thing.
Can
Extenders
I
are
add
about
something
two
real
pounds
quickly?
of tension, right? Like low tension extenders. So if we stretch this over a 6 hour period, it's only going to be like what? 6 times 2, that's 12 working pounds of force. So if you hang for 12 hours or 12 pounds 1 hour, you technically get the same amount of fatigue just on paper.
does it work like
Yeah.
that though? I mean, I'm not being
I
funny.
mean,
Like, can you
I mean,
can
So
you
technically, go ahead.
that's how you would calculate it. That's how you would calculate it if it's if you're looking at it like total volume. In a training aspect, it would be like sets times reps times weight, right? That's total
Yeah.
volume. That's total training volume. And I have actually wondered if it is that linear. If nothing else, it gives us a really good point to sort of compare from, though.
So,
You know.
in my opinion, it's like a bell curve, and
Mhm.
there's going to be a sweet spot at both sides where you can do a decent amount of work and then a decent amount of weight versus time. And then that's
I
going to
agree.
be the sweet fact or the sweet spot. So, in my books,
Yeah.
shameless plug, I have routines for low tension extenders. They're going to be about 4 to 6 hours. And then we'll have high tension routines that are going to be up to 45 minutes. And it's going to be about the same amount of work depending on how long you go. So,
There are some studies I need to share with you guys, and actually, I'm I'm springing this on you now because I'm like starting to hoard content so that I don't wake up to a damn YouTube video the next day from BD about it. Um, there are some studies that I've been given by a couple of people on Discord, and it's really interesting because when it comes to Peyronie's disease, the data is like conclusive that the longer you wear it, the better your outcome is. However, when you compare length gains across different wear times across groups that wore it for like an hour, 2 hours, 3 hours, and then 6 hours and above. Interestingly enough, like the longer you wear it, and this goes along with the best data that we have on scar tissue. The longer that you wear it, the better that your outcome is for Peyronie's. However, there is a sharp diminishing return when it comes to actual length gains for wearing it much longer. So it's really interesting because you can see that like when you're correcting Peyronie's disease, it's like the longer you wear it, the better you just get better outcomes. However, if everybody gained, I don't know, I'm gonna make up some bullshit number. If everybody gained like an inch, it's like the guys that were wearing it for 8 hours, they might have gained like 1.1 inches, whereas the guys that were wearing it for like 90 minutes gained 1 inch or something like that. Like it's an insignificant amount of time for so much more wear. Does that make sense?
Yeah, that makes perfect sense. So what he's saying is
Okay.
is that the person that did it for 90 minutes got 95% of the gains of the guy that did it for 8 hours.
Yes. Yeah. And like I said, I have somebody even made it into a nice little like understandable sheet for me. But basically they compiled the results and I'll share it with you guys because it's really pretty interesting. And I think it's like probably some of the first comparative data that I've seen like this.
At least we can use it for comparative data.
Yeah. Having to do with PE. Because again, so and that's always been my recommendation from a soft tissue perspective is like if you're talking about plastic deformation of scar tissue, it's like wearing braces. It really is it just comes down to probably the longer you wear it, the better. To a degree. But
you want to say
if you're just looking for size, then seems like we can get away with pretty little bit.
I have a comment and then like a question. And so the only thing with which is a common criticism looking at Peyronie's disease, especially when you're talking about length, is most of these guys have a curve and then or like a bend, and then you're correcting that bend. And then it's like so when they say that, these guys started and then they gained X amount, like how much of that is from actually correcting that bend? Because typically there is a loss of size with Peyronie's disease. Still very fascinating data. But the one question that I have,
the angle of reduction does not linearly correlate with the length that is gained, which basically means that they gained length. Along with correcting. Does that make sense?
Yeah.
Like if you measured along the curvature, it still wouldn't make sense how long they ended at the end of the study.
Yeah. So there's clear growth as well as correction of the angle.
Yeah.
Yes. And yes. So, there is growth that is not a direct result of the correction of the angle.
So feel free to tear this apart.
Of course.
Okay.
So if I were to say, you know what, so this is embarrassing, mister, I can put my leg behind my head, but like at one point my goal was to just touch my toes because I'm not a very flexible person.
You know what? Same, Hank.
And so in my mind, I mean, it's not like, all right, if I'm going to try to touch my toes, then I need to do stretching every day. I don't think like, all right, well, let me take a rest day off from stretching. It's just like the progressive stretch. Now I know that we're talking about like complex musculoskeletal tissue, but why would that principle, just briefly not apply to PE?
Okay, so one of the things that I actually used to do is I used to teach stretching classes to dancers. I used to own a dance studio where we taught.
I'm sorry, what haven't you done?
And you're going to need to do something to prove that
he's done photography. He's been in a metal band, and now he owned a dance studio.
We did
coaching stuff. He's just an anomaly to me.
We did pole fitness, acro yoga, silks, lyra, like all the stuff that you see in Cirque du Soleil. So like somewhere on YouTube there is actually a video of me pole dancing and doing tricks on silks. So
we need that.
That being said, one of the things that we taught in our stretching and flexibility classes is like stretching every day is one of the easiest ways to like become inflexible.
Interesting.
And that's because we're not talking about mechanical deformation of the soft tissues. Okay, so here's the idea. Your muscles right now have all of the length that you'll ever need to do any wild ass contorted thing that you could possibly think of. So like
Right.
a brief discussion on how muscles work is that there are these filaments inside of them. They're actin and myosin filaments, and they crawl across each other, and that's how muscles contract. And so the fact is that right now, within everybody, as you sit there and watch this podcast, your muscles actually have all of the length that they would ever need for you to do the craziest shit that you could ever imagine. It's just that your central nervous system actually governs how far along those cross bridges can actually release. And so that's why we know that stretching is actually not a matter of training our soft tissues to elongate. It's actually a matter of training our central nervous system to allow us to be safe in those positions.
Okay.
Which is one of the reasons. I mean, like if you think about it, like think about why would muscle relaxers work?
Because of the
You know
nervous
what I mean?
system response. Okay.
Right.
Yeah, I'm not disagreeing with you. It's just Hank's reaction was kind of funny. That's all.
Oh no, I was just kind of
Okay.
back listening. Yeah.
Um,
Hey, quickly before, I thought this was an interesting question that comes up, and just somebody in the discussion said cold showers. Basically, what are our thoughts on cold showers in regards to PE? Like, just quick rundown because this
I
comes
just
up
don't
often.
like being cold, so just a big no for me. Go ahead, guys.
Go
Cold
ahead, Brett.
showers actually increase. Cold showers actually increase. I think it's growth hormone secretion, and interestingly enough, it's one of the reasons that we think that Japanese populations actually outlive Americans by an average of 5 years. Is because the Japanese people have a tradition called ofuro, and the ofuro is this like traditional Japanese hot bath before bedtime. And so it's not actually the heating that goes on; it's the rapid cooling that it releases melatonin and growth hormone that actually helps them sleep better. So cold baths, cold exposure is really good for your immune system. It's very good for your lymphatic system, and we do know that systemically it increases blood flow, even though acutely when you're exposed to cold, the immediate reaction is vasoconstriction. Um,
Right.
the the long term reaction is actually vasodilation and the formation of new blood holding tissue.
So I guess my question is 10 minutes of a cold shower really going to raise growth hormone that much to make it worth it?
Um, I mean, if you're doing
Just like
cold showers,
intermittent fasting too. Go ahead.
yeah, if you're doing cold showers just for PE, probably not.
And like I use my warm showers as a warm up to PE. So
It's a healthy enough practice that I think that, if you're gonna do it, like if somebody's asking, is there any benefit to it, then yeah. And I mean that's a concept of like, the concept of aggregate, what is it called? Aggregated effects or something like that. It's like if you find 10 things that give you 1%, all of a sudden you have
you're at
10% more.
10%. Yeah.
Okay. My I don't particularly see a merit to it now. There's, especially when you're talking about like the dopamine system and like the reward system, like huge benefits. But if we're just talking strictly PE, I personally don't see a benefit. I wouldn't recommend it. Certainly not before or immediately after PE, in my opinion. But if you wanted to incorporate that practice, go for it. I think it'd probably be fine overall.
This is actually a good
Yeah.
tangent. Wouldn't that also cause a sympathetic response to the nervous system? The immediate shock of cold.
Acutely, yes. But again, so the way that our dopaminergic system works, and what he was talking about is, there's no such thing as a free lunch. So for every high that our body gives us, we get a low. And so interestingly enough, we can modulate dopaminergic responses by doing these sorts of things like cold plunges that actually make us very uncomfortable. And that modulates a dopamine response that, whenever dopamine is released, it binds with a higher affinity. And so we actually get more of a high after we do something uncomfortable like that.
Right.
So yeah,
I
I mean,
bring up, go ahead, finish your thought. I'm sorry.
oh, I was just gonna say I agree with Hank though, and that was a point that I didn't really think to answer, and that was irresponsible of me. Yeah, like don't do a cold shower right before you do PE. That's dumb.
All right, so no cold showers is the recommendation from all three of us, is what I'm getting. Or at least in the
No, I
relation
mean
to
I
PE.
think, yeah, in relation to PE, it's like I mean, it's probably not going to do much.
Not a good idea right before PE. Okay, so I brought
Definitely not.
up the central nervous system because Perv/Adam has been trying to beat this idea into me that the nervous system is responsible for the facilitation of healing. So now that I have him captured live, I want him to explain that a little better.
Before you go on to that, now I'm not going to go into any details of the conversation that we had like last Friday night or something, but we were talking about things that could possibly modulate the CNS. Was that a successful experiment?
Oh.
Yes, actually, funny enough.
Okay, because you never did report back. I don't believe.
He told me the next day about it.
I
If he
told
wants to
him
share, he can go right ahead. But
I don't want to share. I think there are some things that I do that are a little too irresponsible for me to say out loud and on video.
Yeah, but in general,
So
you experimented with basically CNS depressing agents and saw some benefit.
yes, there is a specific CNS depressant that is routinely used recreationally, I guess, to relax smooth muscle. Um, so it relaxes smooth muscle and it also downregulates the central nervous system. It's rather short acting, which is one of the reasons why I didn't really have any concern about sort of screwing with it, for the sake of the community.
this will
Um,
probably come out in 6 months when I eventually try it. But anyway,
the video is going to be up tomorrow.
no, I gotta actually find a good source. Anyway,
Um,
back to the CNS
so
response and how it facilitates healing.
yeah, so I basically used a CNS depressant that is also a vasodilator, that is also a smooth muscle relaxant, and I saw a immediate increase of almost an entire percent of elongation in less time. I think in like 15 minutes less time than I'm used to extending.
All right, now was this today or last Friday night? Because you told me
This
this
was
today too.
This
Okay.
was last Friday night. Yeah, what I did today was a totally different experiment, but it's along the same line. So just to fill everybody in, um, I made it a really big deal today to like be in a super relaxed headspace, and I've been bitching to BD for a little while, like ever since I started back from my break of a few months ago. That like I've been barely hitting 2% elongation, even with like my tunica release technique and stuff like that. And Beatty had been trying to sort of convince me, not unsuccessfully. I mean, I believed him that it's like systemic inflammation and all this stress and shit from having COVID and sinus infections and just being sick and stuff. And then today was really like the first low key, like I was actually by myself and, I like laid down, put my Apex on, and I reached an unprecedented amount of elongation literally out of nowhere. And having trained just yesterday and got like 2% elongation, and then trained again today and got 3% additional elongation. And so it's just like, what the hell went on there? And the only things that I could really think of was that it just made it a really big deal to just like, I told him like I was listening to an audiobook and I was sort of like almost dozing off in between it. And I was really just in a relaxed headspace.
Any comment, Hank?
No,
Yet.
I mean, I think there's validity to it. There's just like there's so many levels to PE. It's I think we're just really scratching the surface of it, and it'd be interesting to see where we're going to be in like 5 years,
Mhm.
as far as like protocols, like even potentially relaxation protocols. It'd be interesting to do a study with like meditation before PE for like 5 minutes and just see what that
I
does.
just recommended that in my most recent video because
So
there's
BD, I was
basically
about to say, I think that you should recap your video for people that are watching, because I think
the
BD
getting
for
bigger hotline.
yeah. Well, I mean, okay,
Okay.
so that was a concept that BD shared a concept with me a few months back about a client that he had, and it really sort of not that I wasn't driving home the whole CNS thing before this, but it really did it put the nail in the coffin. It put the nail in the coffin for me that the CNS is really, really actually modulating our gains in PE in a way bigger fashion than I think that anybody has previously talked about. So why don't you go ahead and just
Okay.
talk about that?
So the gist of that video was that someone was complaining that they have not been able to gain for 18 months. And my argument was on the Reddit originally is that since he was having such a negative feedback loop of his nervous system because he's always getting worried about PE not gaining, it would put him into a mild
sympathetic
state where he would not be able to stretch, not be able to fully reach fatigue. Because when you're in a
sympathetic
state, you get really damn tense. And if you're tense, you're going to fight against yourself while stretching. So you're just going to have an uphill battle. And one of my clients who has, we're going to just say, an anxiety disorder for simplicity, I made him start trying like weed gummies, and he was able to hit elongation much faster than beforehand. So when we finally shut off his nerves, he was finally able to elongate under an hour. If we're going off of my metrics, which Hank may or may not believe in. But there was a clear change in the response either way.
No, dude, if you tell me something, I'm going to believe it just for the record. I am a kind of old school in the sense that, like, I have actually used the term, like, keep it simple, stupid.
Mhm.
It's I will tell you that, not to hijack this conversation, but ever since really, like, I guess this YouTube thing started popping off more for me, like, I have never been under this kind of stress as I have in as far as like work, and then always worrying about stuff anyways.
Right.
I'm still seeing some stretch flaccid gains, but my like erect changes haven't been where I would like them to be, especially not for being like 6 months since I did my like 3-year update post. So
Right.
yeah, I just think, could that be part of it? Certainly. I mean, could it be also that I'm like barely getting 15 minutes of PE in a day? Like, oh yeah, probably that too.
And I know what Hank's personal life is out of this. This is probably the most stressful situation you could be in, like as in the first world right now. So for him, it's going to be
Yeah.
quite an uphill battle for him to first make time, have adequate recovery, and everything else. So
Yeah.
I think it's I think we've got, we've got a lot of data to show that these types of recovery factors are huge factors in any other type of endeavor that we undertake with our bodies. And so I don't see why, I don't see why they wouldn't be as big of issues when we're talking about PE. We never underestimate
exactly.
we never underestimate the importance of your stress levels and your nutrition and your sleep and hormones whenever we're talking about building muscle and building strength. And so all we're doing here is we're literally just talking about the exact same thing, but we're being very regionally specific about it. And so I agree with Hink. I think that in the future we're going to see a lot of protocols that deal a lot more with some factors that we haven't seen talked about up until now.
Before we wrap up this section, I think we need to stop treating the penis as it's being super special to outside the body, right? Because when you break it down into its tiny little pieces, it's the exact same tissue you find everywhere else in the body. It just has a different function. So if we start treating it like we would treat, say, fascia, we will have much similar results as to physiotherapy. And that's like the thesis of my entire book. Are we good to move on, guys?
Yeah, let's do it.
Okay, so we are talking about the P shot. So Hank had a interesting conversation with Brandeis, Dr. Brandeis, the founder of the P long study. One of the main components was the P shot. He left a lot to be desired, in my opinion, about the explanation of the P shot. So we are going to go into it now. Does anyone have questions before we start?
Yes, you were restarted P shots.
Yes.
I'm curious for myself what your experience has been so far.
So, granted, I've been sick for literally 3 out of the past 6 weeks during this situation, but my stretch flaccid has went up 3/8 of an inch. In the Hank measure, so 2 minutes into the pump, my length went to from 7.5 to 7.75. So like there was a quarter of an inch in just expansion length, and then 3/8 of an inch in stretch flaccid length. I'm yet to have a good day to measure erect. So there was clear and obvious change. The issue is I don't have any like real good data to compare it to just yet, or at least I haven't compared it to my old gains.
Okay. So I'm kind of getting the vibe that you are a believer in P shot.
I've always been a believer in P shot. It comes down to how the practitioner puts it into your body.
So let me be very clear. P
Mhm.
shot leading to enlargement.
Faster rate of gain. It does not work out without penis enlargement. You need to have a foundation in PE to build it up. So to me, it's kind of like the steroid of PE.
Okay.
So
And
go ahead.
well, no, I want you to go into basically on a, I'm not like breaking down molecular shit, but like, what is it that you think is truly leading to those gains? Your best understanding. Oh no, BD, I can't hear you, buddy. Adam, can you hear him?
I can't hear him either.
So while we're waiting on him to fix his mic, go ahead, Adam. I want to hear your take on it because we kind of briefly talked about it.
um, which part do you want me to start? I'm sorry, I gotta plug my
So
phone.
all right, well let me start with what my problem is, okay? And so my
Yeah,
like
that'd be good. That'd be good.
my fundamental like kind of problem or like lack of understanding that's prohibiting this is when I think of like enlargement, I think of dilating the tunica. Like, yes, I can't hear you,
Okay.
BD. Yeah, is basically dilating the tunica. And so I don't understand, like, even if you're saying, well, we're going to release factors like, and activated platelets and they release growth hormones, how is that specifically going to lead to more tunica dilation? That's what I'm fundamentally like not understanding.
So when we inject all these growth factors, well, okay, let's back this up. When we activate the PRP, what we're actually doing is squeezing out the growth factors. If the tissue is overly fatigued or damaged, say you had erectile dysfunction for 10 to 15 years, and you have just a lot of creaky tissues, a good way to put it, those growth factors will bind and then signal more platelets to come in and fill in that void. And every time you pump, you pull in more platelets, and you're basically creating like a storm of growth activity based off the pulling in of platelets via the growth factors over the next 6 to 12 weeks.
But so once again, I just don't like, how
Yes.
do growth factors lead to tunica dilating? If we're talking about like
So the
collagen
dilation
peptide
needs
bonds.
to, so the penis enlargement part of this is vital. So you need to do your stretches, you're hanging, you're pumping. But all we're doing, just like in bodybuilding, is when you add a steroid, the results come in faster. So the healing response is going to be faster. It's
I
not
think
going
I
to make you
understand.
dilate faster. Like you're not going to pump up more. You'll get more inflammation based off of the P shots, like growth factor release.
I think I might understand what Hank's disconnect is. Um, so Hank, you and I talked about this. So, like,
Mhm.
in my understanding, it's the initial trauma that is actually caused by the large amount of fluid that's just injected into the corpus cavernosum,
Uh,
and so
so like I'm looking at this from like a cumulative fatigue aspect because it's used to treat erectile dysfunction first and foremost. So like
right,
those tissues are going to be very sensitive to growth factors.
sure,
And if let's say you've been doing PE for 2 years poorly
mm,
and you've developed a lot of, just beat up tissue, those growth factors will have a good uh, bed to bind on and then have more platelets come in and then, mature into potential new collagenous tissue.
sure.
Go ahead,
Yeah.
Hank.
So no, there's just like I don't know if it's a mental block or what. So like if you were to say, and I think Brandeis kind of alluded to this, like, okay, well, if you do PRP, it allows you to recover faster so you can like train more frequently. So if we're talking about going
Yeah.
from like 3 days a week to like 7 days a week with the PRP, like, okay, that fundamentally makes sense. But like, uh, so like the PRP, the way I understand it is like largely when you have like arteriogenic damage, so damage to your actual like
Hmm.
blood vessels, arteries,
Hmm.
veins, and from like things like chronic high blood pressure or
Yes.
chronic diabetes or
Let me
like, you know,
interject. When I do PRP, I just notice like much faster filling out of the tissue, if that makes sense. So like if we're looking at this in the two separate tissues, the blood vessels of the penis seem to get much more growth activity than the tunica. So like my erections get harder, like over time faster. So like I'll have freaky erections by week 4.
okay. So would I mean what if you were to say, look, Hink, when I do this, I get like freakier erections, and so
Mm-hmm.
I'm harder when I go into a pump, or I
In
therefore am
general.
able to clamp more efficiently, and that is what I think is leading to that dilation. I would say, all right, like that fundamentally makes sense, but I just
Okay.
don't understand the correlation between like tunica dilating and stretching and growth factors.
So the tunica
If we're talking about
dilation is
like
still
a
going to be all on you. You're still going to have to do your normal routine to get the fatigue needed to grow, right?
right,
All we are doing is adding some secret sauce to make it grow faster after the fatigue sets in.
okay,
So like it's literally, to me, it's as simple as steroids for your penis, because the naturals can grow muscles still, right? The PRP just, or the steroids just make the muscle gains coming faster. You won't gain that much muscle on just steroids, no training. Same idea. You won't gain much penis size
yeah.
just on PRP or P
But
shot.
there is a precedence there. There is a precedence there with steroids because there are comparison studies to if you if you have somebody who does just sit on their ass and you do give them anabolic steroids, they will gain muscle mass. But
Yeah.
it is insignificant compared to if you were to give them anabolic steroids and then prescribe them a training or exercise regimen. And
Yeah.
so I
So
think
it'd be the
what
difference between like gaining 1/8 of an inch on P shot alone versus a quarter of an inch to a half an inch with P shot plus PE.
correct. Yeah.
I can see
Interesting.
the wheels turning.
No, the gears are kind of locked up.
Okay.
They're trying to turn, but like it's just smoke coming out, and I don't know. Sometimes I just kind of
You'll sleep on it, it'll make
hyperfixate.
a lot more sense. I have a
But
feeling.
no. I
No?
don't think so. I mean, I think the only thing that's going to work for me is taking like a deep dive into it. I mean, but even things like talking about the muscular tissue. I mean, and even using like steroid references, and I think even like Perv use them like a muscular tissue reference.
Mhm.
Like I get that when we're talking about like nutrients and muscle tissue growing, but like this is like a sheath of tunica. Like
Okay, so the tunica has to grow during your session, right? It just has to. Over
yeah,
a year, it needs to get bigger. It's not just going to be an elasticity response.
yeah. No, I mean that's the only way you can get bigger is by your tunica elongating. I mean, yeah. I mean,
So
kind of
if we're able
period. End of
to
story.
grow faster with PRP, signaling more growth factors, more stem cell activity on the tunica albuginea, it will grow faster with PRP.
So I guess my fundamental problem, and I don't want to take too much of this because
That's
there's other
okay.
stuff to get to, but like in my opinion, when I
Mhm.
think of PE, I don't think of like accumulating extra tissue. Okay, like the one
Hmm.
rate limiting factor is the tunica kind of period end of discussion, which is why when they actually injected something like lysyl oxidase to actually break down the bonds of the tunica
Right.
and allow them to expand, like that alone led to enlargement in size. Like to me, that makes sense. Okay, you're breaking down the tunica, like that makes sense why this agent would cause this. I don't
Okay.
think when we're like, I think we're chronically like stretching out the tunica, not necessarily adding additional tissue. And so, because that's not how I view it, I don't see how growth factors would potentially help with that.
Okay. So, and someone in the chat just brought this up. This is a game of healing to me in Perv. So if you think about
Yeah.
this in like the macro perspective, yes, we're creating a lot of trauma, but if we modulate the healing response, we can see faster gains. And that's what's
Yes.
going to be the next discussion with the peptides. It's just
So I
like,
would
go ahead. One of you.
um well, I mean, cellular proliferation absolutely happens, and so even with the injection that you're talking about, so where it breaks down the tunica, um, you know what? I mean, I guess what I would say is the economic nature of the body is to have only as much or as little as tissue as possible to perform a specific function,
Sure.
right?
Sure.
Okay. And that's part of Davis's law, that's part of Wolff's law, that's part of the mechanostat theory, right? And those are all three of the
Sure.
things that we largely base PE off of. So we know cellular proliferation happens, and so I guess I'm a little I mean, why wouldn't cellular proliferation happen in the tunica?
So, all right. So, like, we're going down to a cellular level, but my whole Hink's whole theory of enlargement is this is like the process of aortic aneurysms, and like I say that all the time. And when you're looking at an actual aortic aneurysms, it's not so much. It's not about like cellular proliferation. I mean, if this is kind of maybe a crappy example, but like it I think that would mean that guys that were on like growth hormone or like IGF-1, which interestingly enough, I do have a video on this coming up, but would have like higher rates of things like aortic aneurysms if they already have like blood pressure. But
Right.
it's like, so when you look at guys like that, the macrophallus, okay, like guys that have like sickle cell anemia and they develop these massive hogs because
priapism for anyone that's wondering.
yes, they have these like chronic, like pathologic hard-ons all the time. And what they've seen is it literally leads to they literally say, quote, like an aneurysmal dilation of the tissue. And so I just
Right.
think of like tissue
Okay,
dilating.
so let's me just put this question to you. How are we making this aneurysm grow bigger? Because
Well,
eventually
the
it
thing
will
that
stretch so much it would burst, right? But it would
Well, that's what
eventually
can
burst.
happen.
Yeah,
Well,
but
yeah.
we're talking about this in a 6-month period where they're constantly having priapism events, right? So there's going to be a healing response in that 6-month period where they can actually stretch more and more and more.
Right. Yeah, and so that's the other side of this coin is if you're talking about just thinning out the tunica, then you'd actually have an exponentially easier time of gaining the longer you go on. And so the thing is, I would just say it's a fundamentally different tissue that you're talking about because it's not like an aortic aneurysm. It's not just thinning as it stretches out because we have all the precedents in the world to show us that ligamentous and collagenous tissues don't act like that whenever they are stressed. They are stressed, and then the stem cells, satellite cells are triggered, and local stem cells will turn into, whatever types of tissue they need to support, to reduce whatever stressors are actually being placed on that tissue
And
in the first
not
place.
to mention, chronic stress is going to have a different adaptation response than the short periods of stress that we do to it.
Correct. That's absolutely the next point that I was going to make is that these are it would be easy to conflate acute versus chronic stressors. In this case, you're talking about the aorta, and it's never getting a break at all, whatsoever. And so I mean, but also I just think, Doc, that like they're just fundamentally different tissues. We know for a fact that collagenous, ligamentous, and smooth muscle tissues respond to excess amounts of strain and stress by proliferation.
So I just want to make sure we're saying different things, but like
basically I can sum it up like this. You know how like there was this old internet myth that if you did like PE hanging, your dick would get really long, but it would just like thin out?
That still comes up, yes.
Okay, so like that would be exactly what happens if there's no such thing as proliferation, right? If there's just cellular reorganizing.
Got him.
yeah.
No,
I mean, I see what you're saying. I see what you're saying.
And actually, there might be some evidence to that, particularly with old jelqing methods, because a lot of people would report a spade shape from doing aggressive jelqing.
That's crazy. Yeah. I never knew that.
Yeah. That's interesting. I don't want to take too much time on that. I mean, what your guys are saying is the wheels are starting to slowly turn a little bit.
Well,
we'll get there. We'll grease them. Yeah.
I am non-believer. I can be converted, but I just don't. I don't believe.
All right.
So, all right, last thing. So,
Mhm.
Perv, if I'm, oh shit, now I forgot what you said on the podcast. I don't. So, if we're just talking about some guy, now, Perv, please don't go off on your tangent against growth hormone here. But I'm just saying, in general,
Okay.
if some guy
Okay.
were to inject growth hormone, IGF-1, whatever you want to call it, do
Mhm.
you think that that would have in any way similar response? And BD, I want to know what you would say as well.
I'm sorry, I was reading chat.
So, so guys that
No.
inject growth hormone,
Yes.
like, do you think that that would also expedite the healing process of PE?
Do you want to start?
I don't.
Bert?
Yeah. I don't think it would have any additional benefit over anybody unless they had an actual growth hormone deficiency.
Okay. So
Specifically for PE.
specifically for
Yeah,
PE.
specifically for PE, because
Okay.
like again, the reason that guys use growth hormone, and I'm trying not to go off on a tangent. This is my word counter caller that's like going on. Shut. My girlfriend's in the corner over here fucking laughing at me. I hate both of you. She lives with me. She knows how I do. So growth hormone is uniquely useful to people that are taking multiple compounds and a lot of different compounds because it increases the rate at which certain compounds can bind to androgen receptors. Okay. So it raises our threshold to metabolize androgens.
Interesting.
But in the absence of, I just don't see how growth hormone would really help unless you were deficient.
Okay.
I'm
So
fine
my
being
thing
wrong.
with growth hormone is that it is a massive umbrella signal for a bunch of cascading hormones. So it doesn't directly cause cellular proliferation. It, for example, signals the release of IGF-1, which then signals the cellular proliferation. So we would have to take so much growth hormone to have like a significant effect on cellular proliferation when we could be taking a tenth of that with IGF-1 to get the same effect. So I do think IGF-1 actually has maybe a place with this. I'm not exactly sure how much it would affect collagenous tissue, but on paper, if we're going to try to inject any kind of growth factor like IGF-1 or HGH, I'll go with IGF.
Yeah, I agree with that.
So are you? But let me just final answer: yes or no. IGF-1 would aid in PE.
Maybe. You'd have to really test it. Like that's the only way. You'd
Okay.
have to, like I've done IGF-1, fantastic peptide, especially for muscle building. Not so much for PE, but like I was solely focused on putting on mass with it.
Okay.
So
So, fun fact about me is that ever since I really learned about acromegaly in medical school, I have been obsessed with trying to figure out whether. So, acromegaly, guys, is guys
yeah.
that have like a growth hormone. This is for the viewers, not for you, PD.
I figured.
That have like a usually a pituitary tumor that signals like excessive growth hormone secretion. But I have been obsessed with trying to find out if these guys have bigger than average penises. And I can't find an answer. And
Well,
it's like
what
20
Rich
years
Piana
plus.
said is that when he was abusing growth hormone, his penis grew like 1 to 2 millimeters.
So,
wasn't that a joke though?
I think he was partially serious. But
So
again, I was
here's
14
No,
when I
I'm
saw it.
pretty sure. I'm pretty sure I remember I'm pretty sure I remember that being a joke because he like lost some body fat and he just thought his dick was bigger or something.
Oh, well then.
So you guys know about that? I forgot the name of the podcast, but it was Leo and Longevity, rest his soul,
Ugh,
Vigorous
uh-huh.
Steve, and Derek. And this
I
came
forget what
up,
it's called too.
and Vigorous Steve said that he got permanent gains from just no PE. I'm assuming he didn't do any PE, just from GH alone. I'll have to find
And
a clip
again,
and
I
share it
don't,
with you.
I don't doubt that that may be true, but like, was he deficient in it? And that's the thing is that like, you know,
No, this dude
Yeah, this
measures
dude is like a
everything.
proper bodybuilder too.
This dude is like you in the sense that he like with his lab work, he measures everything down to his T and like maximizes absolutely everything. So no, I don't think he was deficient. But anyways, I don't want to waste too much more time. I'm going to do a deep dive and I'm going to come out with a video and it'll be interesting to see if you guys have changed my mind.
the hard answer is maybe.
Okay.
To IGF-1 being useful. Okay.
Yeah.
So back to PRP.
Hey,
We
hold
talked.
on,
Go
2
ahead.
seconds. I
Yes.
think Hank should probably answer this really quick. Somebody in the comments said, doesn't the aorta have a tunica similar to the penis?
Yeah, so actually, that's what I was going to push you on when you were saying, well, they're like different tissues. The aorta has a tunica intima, the inner lining, the media, the middle liner, and
Yeah.
externa. Literally, they're called tunica. And so the tunica of
Yeah.
both the tissue is made out of the same types of largely type 1 and type 3 collagen. And so
Hmm.
to me, it's like it is like the perfect like case study if we're saying, okay, I mean, and the reason why I perseverate on this too is like in those anti-lock studies, like I had this idea about tunica dilation that I've gone on the record saying before. And then in the study, they were
Yeah.
literally like, we chose anti-lysyl oxidase because this literally leads to aortic aneurysms. And so we therefore thought because it's the same type of tissue, this would what would be that would lead to gains. And so, yes, viewer, you are correct. The tunica is extremely similar, it just has different names.
All right. Let me just
Yeah.
interject some fact real quick. Anti-lysyl oxidase, anti-LOX, is what stops collagen from binding and forming. So they
Yes.
injected into a
Yeah.
rat's penis. They literally pumped up these rats' penis, and they had crazy amounts of growth. Like we're talking like 20% increase in total size in what, a 12-week period or something like that.
Yes. Yes.
Yeah.
And even
So
without doing pumping, just using anti-lock still led to like a 10% increase in size.
I wonder how frequent these rats were getting erections.
Well, that's what they say.
So let me
They think the nocturnal erections is what was causing the rat Ds to grow.
let me interject something here so that
Mhm.
so we know that traction is one of the ways that we can, cause all of the cascading effects that eventually cause cellular proliferation. But one of the reasons why traction actually does it in the first place is because it stimulates our mechanoreceptors.
Mhm.
And that in turn puts, a different type of pressure on the cell walls. So the thing is, if you're talking about having a restrictive tissue and then all of a sudden that restrictive tissue becomes a little bit larger, you're still talking about actually affecting the
Mhm.
mechanoreceptors of that tissue.
Mhm.
So there is a potential that you are still sort of triggering the same, um, you're still sort of triggering the same end result, just with, you know, working it through the back end rather than the front end, I
All right.
guess.
So I
Yeah.
have a proposal. What if the chronic stress the aortic goes through, the aortic aneurysm causes, is a
Mhm.
different growth pathway than what me and Hank are saying? Or not me and Hank, me and Adam are saying.
I think that,
And that's
honestly,
why we're
because
getting completely different like viewpoints. So from our viewpoint, if you treat it like a tendon that goes through hypertrophy due to load, you get a completely different outcome than using chronic stress like you would with, say, an extender or with your chronic priapism.
right. Yeah, because I mean, Dr. Hank, you can attest to this. I mean, Dr. Dan Austin writes in his book Powerlifting. He talks about how whenever we do a competition squat, our heart rate and our blood pressure goes, I mean, above and beyond the point where it would be a major um, major cardiovascular event. And again, if we were talking about acute versus chronic conditions,
Mhm.
then that would be a really, really terrible situation. But we know that acutely that those high blood pressure spikes actually cause, trickle down in the cardiovascular system for it to actually become much, much healthier. And so the, I think that the issue here is that we are talking about acute precision stressors versus a chronic, uncontrollable sort of situation that there's just your body is just
Mhm.
probably not going to be able to adapt to that under the best of circumstances.
Yeah. Yeah, I don't want to take all the time talking about this. I mean, those are all very valid points. Funny enough, I actually did see a patient today that had a arteriovenous malformation, and they were actually doing squats, and actually it ruptured, and they had a brain aneurysm bleed. So that's
Damn.
so you talk about the adjusting, and you're right. Normally they do, but every now and then it doesn't. So, but that's neither here nor there. Um,
Yeah, there are also correct breathing and bracing techniques that we use in powerlifting that not all people follow and not all people are aware of.
sure,
And
sure,
so, I'm not going to say that it's not without its dangers.
yeah, sure. But all right, what's next, BD?
All right, we're talking about BPC 157, and this is something me and Adam both have experience with. So, like the pea shot, we are trying to elicit as much growth factor as possible. What the like how BPC 157 works on paper is since it binds to the damaged tissues, it signals the release of growth factors to flood the area, pulling in platelets, causing cellular proliferation, protein transcription. In most studies, they'll see like anywhere from a 25 to 75% increase in healing rate. So that is why I've tried it, and I saw relatively good results. So we're saying like 1/8 of an inch in 10 days, but I am yet to repeat that. Yeah.
I
So
remember when you did that.
Yeah, and like it was relatively good evidence too, but I just couldn't repeat it. So either my stock went bad, or since I switched to fat pad injections, so I did not have scarring, it is inconclusive.
This to me is a very similar thing to I want to be very clear and go on record that I am not saying that PRP doesn't work. I am not saying that like BPC 157 doesn't work. So just if for future viewers are like, well, you were on that one podcast in January and you said it didn't work. Like, no, I never said that. Okay. I'm saying that like I am one of those guys that like I am not inherently like brilliant, and I have to like sit down and like really put the pieces together myself. Now, admittedly, there are some pieces that I think are like very like my pathway of thinking about it is like distinctly different from you guys's, and I think we're like getting to a similar approach. But so like if I don't believe PRP is going to like do anything significant, then I don't
BPC is
inherently
sure as shit
think
not going to do it. Yeah.
Than BPC 157. My biggest thing about BPC 157 is that if you are going to be using it, my understanding is you need to be doing like injections essentially daily. And I have a lot of reluctance to in any way endorse that when I know that even doing just saline injections into the penis can lead to increased rates of Peyronie's disease and scarring. So it's just something that like, and I mean, even if you were to say, Hink, here's a published paper showing that if you inject BPC 157 every day for 30 days, you will gain an inch of penis size. I would have a very hard time sticking a needle into my penis. Just like,
Yeah.
it's just one of those things that
there
I
is a
can't see
reason why I
myself ever
haven't
doing.
talked about it for a while.
Yeah.
Because like I think Adam has a much better experience with intercavernosal, but to me it just got more and more painful.
Like
So like it was
That's
just not
interesting.
worth it at that point. And it might
To
like
me,
it could be scar tissue forming literally as I sat there and pinned every day. And like I
to me, it
still
actually
have
got easier.
you're weird.
I know. No, I think
But like
I think I actually just uh I honed in on like exactly where I was in terms of like getting in the tissues and just avoiding anything that hurt at all. Because by the time that I ended this last round of BPC 157, I literally found a spot and
with no
I
nerve
could just
ending around it, huh?
yes, I could literally just slide it straight through and it was like no resistance and it just I would go to push the plunger and it would just feel like I was pushing it into empty air. And that's how I knew that I was.
Lucky you. Okay.
and so that was the same spot every time though.
Yes, the same exact spot every single time.
So there is a dude, I doubt he's watching, but on he runs the like I think Pharma PE like subreddit.
Uh-huh.
His name is like, and then of course BD is doing the loudest thing possible with his microphone still on. But it's like something like JG 1951, but like dude is smart
Okay.
as absolute like I'll have to forward you his name. Like he has like brilliant stuff, especially when it comes to like Pharma PE. But when he
Okay.
does, like we diverge because he is more in favor of like Pharma PE like injections and I am
Mhm.
not. But he has this protocol that makes sense about like, well, if you're going to inject, you need to like rotate the injection site. But he also says you need to be injecting like this, and this to minimize like, fibrosis formation. I guess if you're injecting a healing peptide, it kind of negates it. But I would
Oh, it
just
could
urge you
also
caution
increase
with
it too.
injecting the same spot. like each time. Yeah.
So typically I would agree. The secret sauce here, though, is that every single time that I would do a BPC 157 injection, I was also doing the tunica release technique. And so you're talking about you're talking about a technique that, in and of itself is shown to reduce scarring and fibrosis and densification. So
Right.
I would be willing to bet that the effects would, at the very worst, sort of wash themselves out, because you are injecting a healing peptide. You are doing something that, in the absence of a healing peptide, is known to normalize the tonus and texture of collagenous tissues. And so, to me, I think that, that sort of mitigates the risk of it. That was my logic, anyways, and that was, why I didn't really ever worry about it.
And let me add one thing about my experience with BPC 157. I was also trying PGE-1 at the same time, and those were very painful and intense erections for me. And that could have been half of my issue with any potential fibrosis, is that the PGE-1 injection was the real issue for me.
Yeah. So any viewers watching this, if my recommendation would be to rotate injection sites. I mean, what you're saying, Adam, I mean that definitely makes sense, but I think I don't trust everybody to know how to do a tunica release like you do. I'll put it.
I'm not recommending
not
that.
to inject anything.
Yeah, no. First off, don't do that. Period. However, the medical community's recommendation is to rotate injection sites, and that is, of course, that's a basic practice. And so, yes, of course, Hank, I agree with that. I just do stupid shit on television for fun.
Television, yeah. Okay. Let's see. So, since Hank's not really a believer in PPC 157,
well, hold on, Beauty, because I want to see if you because you were tuned in to the end of our podcast, but Hank and I were talking about, okay, so like maybe BPC 157, maybe it doesn't work, maybe it doesn't do anything, but there is this chance that, because of the way that like saline injections and sham surgeries and stuff like that, no, it's not a placebo, because it has nothing to do with how you. Okay, it has nothing to do with a somatosensory response. Okay, it has to do with the fact that it actually elicits the pooling of local healing factors into the area, and of course by
would be more like an immune response, though, right? Because it's in a foreign agent going into the body, it'd be an immune response, which would bring in growth factors with it.
I mean, it's normal saline. I'm not certain how.
It's still something unknown to your T cells.
Okay.
So, like, no matter what, you're going to get a hormone response from it.
Sure. And so my basically, like, I've looked a lot at sham surgeries and these saline injections, and it's just really, really interesting, because like Hank and I were agreeing on the fact that, like, overwhelmingly sham surgeries and these like saline injections have an incredibly high success rate, especially when compared with the actual interventions.
Guys like saline pump for fun, right? So they'll like take they'll jab this side of their skin, start pumping in saline solution, and they get these just massive bloated dicks, and like they can train
in like what too. Like
they just walk around, or are they doing it sub-Q?
Sub-Q or CC?
So most of them are going to do sub-Q. That's what's taught.
Yeah.
So under the skin. So I don't know. Then if we're gonna, this is another tangent. They'll take it a step further.
I've seen that done with breast tissue, actually. That's a thing. That's a treatment. You can go to like a med spa and they'll do that.
Well, they should start doing it to penises. They'd probably do it with hyaluronic acid, though. But the real serious people in this fetish community will start injecting silicone in place.
I've seen that.
Yeah, or synthol. So like they'll pump up, they'll bring in more silicone each time, and then they'll have just a ridiculously permanently mangled but larger penis in the process.
guys, please don't ever do this.
Yeah, don't ever do this.
Oh,
It's like
God,
your
this makes my
penis will
brain
not
hurt.
work. Like straight up, you'll have erectile dysfunction within 2 weeks.
Yeah.
But like I've seen a guy that literally has a penis the length of his entire leg. His name is Muscle Eddie. No one look that up right now. Save that for later. But it is absolutely nuts. I can share photos with you guys later because I just have.
But it's actual. It's a non-functioning penis, is what you're saying.
Well,
Like,
he can still urinate. He doesn't have any like skin infections or anything like that. But it is literally just a hunk of meat, or I guess silicone.
so, but as far as like getting an erection,
Mm-mm.
it's just
there's no physical way because it's mostly silicone at this point.
All right.
So, no one else tried.
That's like having a really nice car that just doesn't fucking turn on at all. It's like
So
having a
he was
Ferrari.
in escort, and then he was also like artist at the same time. So I think,
Interesting.
All right. I have TB 500 written down about this stuff, but I don't know much about it. Do you guys know much about it?
Just as far as it's like a healing, and what is it, like thymosin beta? Is that
beta for TB 500 is a synthetic version.
Like one thing that I don't think people understand, and I don't know how much this is true for BPC 157, but I know for thymosin, that is actually elevated when you're looking at especially like GI cancers. And so there is a theoretical risk of actual malignancy developing. Now, theoretical, this has not been proven.
So let me interject.
Yeah.
One of the risks with BPC 157 is potential cancer proliferation. Same with IGF-1, because we don't know much about BPC 157. Period.
Yeah.
Like we've only been studying it for about 20 to 30 years. A lot of that stuff has been shelved.
Right.
So like we just don't know.
Jesus, quick anecdotal story. I feel like Adam here, but when I was in residency, I treated this bodybuilder. Shots fired. And this dude was one of the biggest guys I've ever seen in my life, especially at the time. And he had the worst hepatocellular carcinoma I've ever seen in my entire life, a liver cancer, and ended up dying shortly. And without a doubt, like he had a steroid abuse induced malignancy. Like I know it, and I don't know whether it's a combination of like orals that caused liver damage, and then he did like growth hormone and stuff that caused anyways. So I just, for my guys out there on gear, I just have a lot of reservations kind of in general, but I'm a old
it's like to be clear, most anabolic steroids were developed for the purpose of treating muscular wasting diseases, including cancer. And so to my knowledge, and I'm willing to be corrected, to my knowledge, none of them have been shown to be carcinogenic. However, they can accelerate or exacerbate.
Well, we also don't know how clean his gear was, and there could be some kind of agent in there.
And when these guys develop like hepatocellular carcinoma, for example, we aren't like, oh, by the way, were you on steroids at any part in your life? And so there's a lot like we don't know, and I don't know as much about. I guess like even if you look at SARMs, like SARMs cause liver enzyme like spikes.
Basically, all orals do, yes.
Yeah, and so like if you are causing damage to your liver, like that in its chronic damage leads to cancer. So anyways,
and so that was going to be the next point.
Yeah,
that was what I was going to bring up, is that so cancer is just, and this is a kindergarten primer of cancer, but cancer is just cells not working correctly, right? And so it happens through the process of mutation, right? So the more opportunities we give our body for mutation, say by taking something that fucks with our liver, or by going outside and chronically exposing ourselves to UV and radiation, anything that we do that increases our mutagenic sort of chances does have the capacity to be cancerous. And so there are things that you could potentially be taking that are I think I just wanted to make that little slight differentiation there, that like it's not as if performance enhancing drugs cause these things directly, but they can certainly facilitate you getting all kinds of fucked up if you're not smart about it. And so that is one of the reasons why I will go on record and say that.
Like you can
Yeah.
be as safe as you can be on steroids, but you can still fuck up the rest of your life on them.
That was literally going to be my next point, is that, like um I compete at a world level in powerlifting. I'm currently chasing an all-time top 100 spot, and that is all time in the history of the sport, and so I will go on record and say that yes, I use performance enhancing drugs, but I would never see any reason to do so unless you were
Yeah.
performing at a similar level.
Yeah. No, I agree. And the last thing I'll say, because it's not going to turn into a cancer talk, is actually, like, most people don't realize that one of the most carcinogenic things is actually alcohol, and so that is a WHO level category 1 carcinogen. But anyways, back to the PE guys, because that's what people came here for. So, what's
We were
next?
talking about TB 500. We don't know much about it personally, but there's more research
Yeah.
on TB 500 than BPC 157.
Mhm.
Binds
Can we
active
divert? Hey,
together.
Herb actually has a question.
Go
Um,
ahead.
I'm
Keep it under
interested
10
in this.
words.
No. Um, is alcohol bad for gains?
Yes.
I've seen this question a
Straight up.
lot, and I have thoughts, but I want to hear from a clinician's point of view. You talk about, like, in terms of malignancy, it is a like, alcohol is one of those things that, like, I cannot believe that it's actually legal. It's just absolutely insane to me that it's legal.
You do remember
And
the temperance movement of prohibition, right?
I listen. I know. I'm just saying.
Okay. Just making sure
Like,
you learned it in theater school.
I understand. I understand the importance of alcohol in the history of human civilization. I'm just saying that it is such a dangerous thing, and it's so
Yep.
uncontrolled, is what I'm saying. So
Yeah.
I've seen people ask the question, but I am actually curious myself to hear you
Yeah.
guys elaborate a little bit more on how alcohol. Alcohol, is it bad? Is it well, we
Okay.
know it's bad. How bad is it?
I'm just going to give you an anecdotal story. One of my clients has a drinking problem, and we cannot get him to gain for the life of him. He's finally, like, sober, and we're finally seeing some progress. But when he was on his
Yeah.
binges, he would literally lose size.
Okay, so
Straight up.
funny thing about that, like, you want, I mean, the biggest thing that people don't understand about alcohol is that, like, when you drink alcohol, it is a toxin,
Mm-hmm.
and it is a carbohydrate, but it's a carbohydrate that your body preferentially metabolizes before anything else.
Right.
And so there are cases of, and Hank, I'm sure you can, attest to this. There are cases of people who are, drinking alcohol and who are eating food who develop, like, literal nutrient deficiencies because they're just, like,
Mhm.
they're not absorbing any of the calories that so we talk about, like, I say, like, I don't think that you need to be in a caloric surplus to do PE or something like that, but you certainly don't need to be in a huge fucking deficit where your body is literally priority number one is get this shit out of me.
Mm-hmm.
Yeah.
And then you can add in the super estrogenic effects on top of alcohol, and then the loss of,
Yeah.
like, cardiovascular conditioning along with it, the dehydration. It literally just creates a shit show for any type of cellular proliferation. That's why I'm always confused when I see jacked frat boys, especially in college, because they're drinking every weekend. So, like, there's still something to it, but
Yeah. So, if, if we are talking about, like, moderation, so you have, not every night, but even, like, every other night, you have a beer. Do I think that, and I'm not saying you guys are arguing this either, but do I think that that is inherently bad? Like, no, I don't think it's that bad. I mean, alcohol is a vasodilator. However, it does have CNS effects. And so, like, the term whiskey dick is a very real thing where if you drink too much, you literally won't be able to get an erection. One of the things that I worry about is people don't know that if there are literally cases of guys having heart attacks and going to the ED with something called angina, or, like, lack of blood perfusion to their
yeah.
heart, because they take Viagra and they drink, and it literally causes such a vasodilatory effect that you don't get enough blood pumping to your heart or to, like, your head or to your eyes, for example. So you can have vision changes, and there's published papers, like, showing that this rate happens at even lower doses of alcohol than people realize. And so I don't drink in general. I never have, and so I'm very anti-alcohol at baseline. I don't think in moderation it's inherently damaging to actual PE as far as like I think you can still game on it. Would never recommend excessive use or certainly abuse.
So, just my own little story of alcohol. I am a lightweight. I would drink maybe once a season. But when I quit my job, it was a pretty stressful time. I had some in the house, and I would get some of the best boners of my life at like 2/3 of a bottle of beer. But anything more than that, I would actually start losing my erection quality.
Yeah.
And then like some sensitivity. So
Tracks.
Yeah. Well, and a lot of that could be because, okay, so erections are like our entire sexual system is really interesting because it teeters and straddles sort of parts of the autonomic voluntary nervous systems as well as the sympathetic and parasympathetic nervous system. So it relies on us being in a very delicate balance of arousal and drousal to actually get and maintain an erection and then to actually orgasm. And so it's really interesting because I see a lot of the guys talking about like anxiety induced performance issues and stuff like that. And so it
we
is
should talk about that
interesting.
next podcast.
Yeah.
Just the entire
I
mental thing of
hugely,
sexuality.
hugely would agree. I think that's a huge topic we need to talk about because I think it's interesting just hearing you talk about, like you had the perfect dose that you knew that would like kick your CNS into that sweet spot where
Oh,
you're
I
like good
didn't
to
know.
go.
It was just luck, but yeah. And then since my tolerance immediately increased, I could never do it again.
Okay, fine. I was trying to give you a compliment, but whatever.
Yeah, no, I do not know much about recreational drugs other than anabolics. So, all right.
I mean, I don't either. Other than supervised psychedelics, I have never partaken in anything. Literally, hard as it may be to believe that.
Mm-hmm. All right. So let's wrap this up with goal setting strategies, and then you guys can chill out with me and answer some questions in the chat. But I know you guys got stuff to do. So I know we all know it's the new year, right? A lot of people are setting very high expectations for themselves and what they can potentially accomplish. I just wanted to know what you guys do for goal setting because I think I do it much differently compared to how I used to do it. So discuss.
We're talking life or we're talking PE?
Like anything. So like obviously PE goal setting is one thing, life goal setting is going to be the same side of the coin.
Go for it, Adam.
I was thinking the best time to start a diet is today. Best time to start a new training program is today. I don't believe in diet starts Monday kind of mentalities.
Right.
I think it, creates an opportunity for you to engage in not necessarily premeditated, but like self-excusable fuck ups.
Yeah.
So if it's Thursday or Friday and you have like some extra chips and queso at the Mexican restaurant, or whatever, and you're like, fuck it, my diet's blown. I'm gonna like drink a Corona and like just chill out and diet starts Monday. And it's like, no, just take the extra chips and queso, like, and just tighten your ass back up, the very next meal. Like it doesn't have to be this catastrophic thing that all of a sudden you just like, like it's called falling off the wagon. It's called running the fuck away from it and lighting the goddamn thing on fire.
Right.
Like fall off the wagon and get right back on. Like so for me, goal setting is not. It's not this huge thing. It's literally like
You just do
just
it.
get to the next thing. I mean, like honestly, it's like a journey of 1,000 miles starts with one step. And I think that
Right.
honestly, as stupid as that is, our brain is really interesting. There's a book called Atomic Habits, and it's really interesting because in
I
that
was about
book,
to say that, man.
I get this is the only
Were you
self-help
really?
book I have not read yet.
Yeah.
So Atomic Habits was actually written. James Clear based a lot of his work on what was it called? It was by Charles Duhigg. Actually wrote it before him. But anyways, he was talking
those
about
tangents we talk about.
what?
I said, those tangents we talk about. I would be hitting my wrap it up B.
Listen. I'm working on it. So, anyways, basically, there's this whole thing where like our brain tends to digest entire projects and things like that all at one time.
Right.
We have a really hard time thinking about climbing a mountain without thinking about climbing a whole mountain. But when you break it down, all it is just putting one, foot right in front of the other and just repeatedly doing that. So if you always just focus on just the next step in front of you, then I think progress is a little bit more guaranteed. And you probably just at some point pick your head up and like realize you've gone a lot further than if you had just tried to eat an elephant all at once.
Right. You have anything to add, Hank, before I tangent?
Yeah. So, I mean, that's, one of the things that I was going to go into, mini tangent here. So, here's a hot take for you. I believe the most potent PE drug is Ozempic. Okay. For those that don't know what Ozempic is, it's basically semaglutide. It's a GLP-1 agonist, which basically delays your gastric emptying, makes you feel fuller longer. And you can see these like ridiculous weight loss. Like some of my friends are on Ozempic and have literally lost like 60 pounds in like 4 months. Okay. But not only that, but there have also been studies that Ozempic helps with things like any kind of addiction, and they're still working through some of like the psychology behind it. But like, so obviously can curb like binge eating, gambling addiction, smoking, drug addiction. It has been clinically proven to dramatically improve success rates when you are trying to beat any of those addictions. So we just talked about like PGE1 and BPC 157. I think that is like an amazing drug. Now, when it comes to goal setting, I'm kind of one of those, like, you need to just figure out what you want to do. But like Perv said it with the atomic habits is you need to break it down like, okay, I want to gain an inch in a year. Okay, well, what that's going to come down to is being consistent or having your routine and doing it exactly the way you lay out day by day and setting small goals. I also think it's important to set realistic goals that you can achieve so you don't get discouraged. That's why, people ask me, oh, what should I expect to gain in a year? I think you should expect, if you are consistent and diligent, to gain a half an inch in length and a quarter inch in girth. And if you exceed that, which if you're consistent, you likely will, but at least when you break that down into a month to month progress and you see that like you're barely getting bigger, but it's consistent with that growth, you're not going to be discouraged and you're going to be more inclined to stick to your program.
Okay. So first thing to unwrap, you said realistic expectations. I fully agree with that, except when it comes to certain things, particularly like muscle building on social media, it is very hard to know what's actually reasonable. Right. And this is what like set me up in spirals of depression, is that I was always trying to basically compete with fake natties. And I would be like, why am I not getting bigger? Not why am I not getting bigger? Why am I not getting leaner fast enough? So like I would literally stagnate because I was ping ponging back and forth trying to like look like them, if that makes sense.
No, that makes perfect sense. Yeah.
So
I think we have a correlation. I think we have a really strong correlation in PE to the fact that all of us are just inundated by porn.
Oh, for sure. That's another issue, but we can talk about that in another podcast. But for me, it's not so much like you guys, how specific do you guys get with your goals is really what I'm trying to ask.
It depends on the goals. Honestly, it depends on the goals. Like if it's financially, for me, honestly, I just like do what I need to do at that moment. And so Atomic Habits, I don't want to keep like, I mean, I recommend everybody read that book. Yeah, I mean, like I'm gonna get a cut, so like what he talks about is like latent effects. Okay, so like your income is a latent effect of what you have been doing over the course of years and months and things like that. Does that make sense? So it's like in Atomic Habits, well, you hope it's cumulative. So in Atomic Habits, he talks about this one, and I will shut the fuck up after I make this point because this is so important.
Okay.
Where you are with your goals doesn't matter. It doesn't matter at all. Okay, what matters is your trajectory. That is it. So if you have 100 pounds to lose and you're losing a half a pound, every 3 days, eventually you're going to lose 100 pounds. But the thing is, like, if you have $1 million in the bank and you're consistently overspending your income by $1 per paycheck, you will
You'll
eventually
lose
go
it,
broke.
yeah. So, speaking of this tracking of weight loss and everything like that, for me, it's always been an issue staying on top of it. So I literally stopped setting deadlines because that always just ended up me being depressed. Instead of like focusing on a number, I would say I'm just going to look leaner. So like for the past 3 months, I've been trying to lose weight. I probably lost 13 pounds in the past 6 to 7 weeks. But since I am so less detached from my goal, there's just so much less stress to it. So I really think there's a bit of a personality aspect with it too, because some people can just set it and forget
Yeah.
it. For me, I just obsess over it. And then eventually, like,
Well,
this isn't happening fast enough, and I switch lanes.
again, and the last time that I'll reference this damn book, but like there are outcome based goals, and then there are procedure based goals. Okay. So a person that says, I want to lose 20 pounds is way less likely to lose 20 pounds than a person that says, I'm going to do cardio every day. Because
So,
one is a goal
right.
and one is a process. So a process gets you to a goal. So if you figure out your process, then all of a sudden your goal just becomes a byproduct of the process. So saying you want to lose 20 pounds, well, who do you fucking do? I want a fucking toilet that's made of pure gold.
You
Like,
just
I
made a
have no
lot of quotes
process.
flood into my head with that. Wow. Trust the process. Yep. Okay.
Yeah.
Does that
So,
make sense though?
Yeah, it makes crystal.
and, I mean, BD, like you're the guy who's always recommending me like books. Like there's a few books that I would say have actually changed my life, and um, one of them is like How to Win Friends and Influence People. I know I'm like outdated. Don't judge
Yes.
me. But number
No,
two,
absolutely. Yeah. Dale Carnegie.
most important, exactly, is Atomic Habits. Like I'd say, yeah, without a doubt, one of the most life transforming books.
Yeah.
I am writing these
The
down.
the power of habit, by the way, the power of habit was the book that
Mhm.
Charles Duhigg wrote that James Clear based Atomic Habits off of. So if anybody's read Atomic Habits and they like it, look at the power of habit, because he heavily cites that book.
Yeah. And BD, as far as like my specific goals, um, and this is probably going to sound arrogant, but I'm actually like where I want to be as far as like my medical profession. And so where I'm now, like looking at like my goals are largely related to our business endeavors, like
Right.
PE and like my YouTube channel. And like you, like I don't know, I won't say like you, but like being like social media presence and like even on Reddit, it stresses me the absolute F out. And so, and even things like I would release a video and I'd be excited about it, and then it's like performing 10 out of 10. Like your content is trash, basically,
It's
is what my
bombing.
YouTube
Yeah.
thing. Yeah,
That's never fun.
yeah, and it used to stress me out, but now like my mindset has just shifted to like I'm just gonna do the best job I can, and like both of you guys, I'm like I'm passionate about what I talk about, and I truly enjoy doing this, and that is
Yeah.
going to be my goal, and that's kind of like a process is like make
Yeah.
content that I enjoy, that I think is worthwhile, and if like I happen to continue to grow, like great, but either way, I'm going to be doing what I love, and so
Yeah.
I don't know.
Become process oriented though.
Yeah,
I think that's
yes,
the point, is become process oriented. So like, don't, it's like everybody wants to be like, oh, how much can I gain in a year? Well, it's like, well, don't really worry about that. Just know that if you do PE every day or every other day, or if you
yeah,
make it a goal of like doing PE, your dick is going to be way bigger at the end of the year than it is now.
Okay,
yeah,
so
yeah.
I've been on harping on this idea of detaching yourself from the end goal, and you guys have described it much better than I have. So thank you for that. I can now steal everything you just said.
Yeah, processes, not outcomes. Don't focus on outcomes, focus on processes.
And
Right.
there is a guy on Reddit, and he does like an interval pumping log every day, and at the end of his
Uh-huh.
log, he says something like detach from the like invest in the process and detach from the outcome or something, and it's like, oh shit, that's clever. I like that. Yeah.
That's profound. Yes. Okay. So I think we beat enough of that down. We can talk about it more in another podcast. I don't know how much time you got, Hank.
I gotta go to bed. The only time I get to go to the gym is about 5 in the morning. And like you, I go to sleep very early.
Okay. So
So
if you want to drop off, I can answer these questions. If Perv wants to stick around with it, that's fine. But no pressure on you guys.
I'm here for it.
So one question I'd like to touch on is YN said, do you ever feel like the guys who complain about not making gains are just super inconsistent or incompetent with their training?
Yes.
Oh, this is going to be a hot take. Go ahead, someone else.
Yeah, you can go ahead. I just want to touch
Oh.
on this before I dip out.
Do you want to go, or do you want me to
Sure.
go?
So basically, I mean, yeah, I've said this before. I mean, to me, and I probably say this too often, but it's like the people who say diet and exercise doesn't work. Like I've tried everything and I can't lose weight. It's like, no, you fucking haven't. Like, so now I do
Yes.
think like there's a guy that BD you did your video on, and in fairness, I only got through like the first couple of minutes because I was in clinic, but like he was doing like all of this stuff, and on paper it seemed like he was doing a lot of stuff right. But I know that you made a whole video about it, and I kind of DM'd him, and already like I'm starting to tease out like, oh no, dude, like you shouldn't have been doing that, or you were doing this too much. And so short answer is I absolutely feel that everybody can gain, and that is consistent with what published medical literature there is. I think personally you're doing something wrong.
Yeah, so in my opinion, most hard gainers are going to be inconsistent, doing too much work, and then out of those 80% there, let's say that's 80%, 20% of them will actually have like a physiological issue that's stopping them from gaining. And 10% of or 50% of that 20% is going to have a treatable thing that we can work on.
Yeah.
So
So real fast, Perv, can you put your arm up one more time and just flex for me?
Gonna give him an insecurity.
Damn, dude, that's pretty impressive, man.
You have good lighting in here.
You got pretty good lighting, man. That's both of you guys are big beefy dudes. I'm like Mr. String being over here. But anyway, sorry.
You
I
have
didn't mean to cut you off.
abdominal insertions that I don't. So
There you go.
Comparison's the thief of joy. But go ahead, man. I didn't mean to cut you off.
I don't even know who was going.
Yeah, I agree. I agree, and I'll like say it louder for people in the back. Like you're just you're not. Nobody is as special of a snowflake as they fucking want to be. And so that's the thing is that everybody that is failing on their diet wants to think that they have fucking hypothyroidism or whatever. And it's like BD and I have talked about this like to death. Like even if you have hypothyroidism or something like that, like it doesn't make it impossible to lose weight. It just makes it a little harder. Like the laws of physics literally still apply to your body. Like thermodynamics doesn't just take a break because your thyroid was like, fuck it, we're gonna act up.
It'll
So
change
the
how
thing is,
whatever's burned, however, right?
right.
So you might lose muscle mass instead. But my biggest issue was knowing that I was not as cool as I thought I was. So like I thought I was so entitled to be, a 250-pound behemoth, but in whatever case, I'm just whatever percentile that I am, and I'm finally working my way through it.
Yeah. And that's the thing is that like, I mean, I'll even like I'll talk about myself like I okay, because when you do like right now I think my squat is actually it's on the all-time top 30 list. And so there are some things about me that are genetically freakish and that I know for a fact and like I am really really good at squatting. For reference though, I think I've told you this BD like I have an all-time top 30 squat. My bench is in the 300s. There are about 300 people in my weight class that can outbench me. My deadlift, I am like number 5,400. So I can't deadlift for shit. So the
But
thing
it's
is
still
like
a 600-pound deadlift, right?
it's still a 640 deadlift. But like that's the thing is like I know that I am a genetic freak in some ways. But yeah, just people like aren't what I'm saying is even my genetic freakiness is not like so absurd. Yes, it's not so absurd that it like makes me function on different parameters than the average human being. It's just like, no, I actually just have like femur lengths that are 15%, longer or shorter than average. And so that allows me to squat really, really wide and squat very heavy.
Interesting.
Yeah.
So no, if P isn't working, you're probably just fucking it up. And like I say that in the nicest way possible because it's just like everybody's like
I don't say
everybody's like I have steel cord and hard flaccid. It's like no the fuck you don't.
Yeah, that's like half of my Patreon is just telling people like, dude, you don't actually have hard flaccid. Like you just have maybe internally. But yeah, and just closing, I would just like to reiterate that like comparison is the thief of joy, guys. And everybody wants to be like a rapid gainer. I personally have never seen like such a rapid progression as, Adam especially, but like I still find joy in the gains that I've made, and I'm very happy. So anyways, with that, guys, I'm going to do my sign off because I have to go to bed. But yeah, guys, remember, there's nothing wrong with self-improvement, but you are perfect just the way you are. All right.
All right, I'll talk to
Catch
you
you guys
later.
in
Hey,
the next
I
one. Later, guys.